Neuroimaging therapy is a type of treatment that's often used by clients who've already had osteopathy, physiotherapy or chiropractic work. Let's see how it works. First, we'll look at Rachel biologically. It's important that the human body maintains a healthy balance of acidity and alkalinity. We check this by using a simple pH testing kit and check results against the pH scale. More often than not, clients lean towards acidic, but it's easy to bring them back into balance. Moving on, let's look at Rachel visually. Right, Rachel, what we're going to do now, we're going to look at you visually to see if there's any misalignments in your body. As you can see in the mirror, you've got one shoulder slightly higher than that shoulder, so you've got sort of that effect leaning over like that. So that's what we're going to do. Your head seems to be to one side as well, slightly turned. Next, I'd like to do is turn to the side. So look in the mirror, look at your back. That seems to be quite normal. And then turn your back to the mirror for me. Thank you very much. Obviously, we've got the reverse in that, and you're sort of leaning back a little bit like that. So that's where your misalignments are. Okay, Rachel, would you like to just lie back, please? I would look at the alignment of your hips via your feet. Your feet should be spurt out like that, but yours are spurt in. Your hips are probably rotating inwards, creating that, and this is part of the pain pattern within your body. So what we're looking to do in the treatment is to realign your body gently, so your feet will be like that. It's common over time that some people need realignment. Let's this time have a look at Rachel biomechanically. Okay, Rachel, next thing what we're going to do is test you biomechanically. First and foremost, are your hamstrings tight? I test that by squeezing your Achilles tendons. That is fine, that side. On this side, again, slightly tighter, suggesting we have a problem with that hamstring, which create a pattern of pain within that part of your body. What is your big toe joint like? If that's tight, then again it suggests tight hamstrings and upward bodily pain. That is fine. And then finally what I'm going to do is pull your fascial skin, which is below your skin. Where I can't feel the fascial pull is basically where you've got an issue. Let's try on the left side. And it seems to be stopping in this area, so you've got an issue around there. And the right side, it's going all the way up to your head there, which suggests this side hasn't got an issue with that area. So your main problem is in your lower back on your left-hand side. Finally, let's look at Rachel neurologically. We can often find issues that are overlooked during blood tests, scans, or x-rays. Okay, Rachel, what we're going to do next is we're going to use this cranial sacral system to work out whether you've got any misalignments in your body. What happens with the cranial sacral system is your brain and spine fills up with brain fluid every 4 seconds and empties to some extent. So what I'm going to do now is pick up whether that is working on a 4-second cycle or not. And then I'm going to look at you as an individual to see whether you've got misalignments within your body based on the fact that I can't pick up those signals in various listening points on your body. Let's start with your feet. Let's start with the cranial rhythm. Is it 4 seconds? The great news is, yes, it is. Then I'm going to check your feet for the signals. Plenty there. Your knees. Then your hips. I can't feel the signal in your hips, so the likelihood is that your hips are jamming your sacrum bone in the back of your backside, creating some of this pain. And then now I'm going to use your shoulders. Slight signal, but as maybe 75% switched off, and then where your skull and your spine meet, where your spinal cord goes into your skull, that is jammed as well. So the axis and atlas bones in the top of your neck are jamming against the back of your head, creating this pain within your body. Next, what we're going to do is my thumbs are now on the side of your eyes where your sphenoid bone sticks out of your skull, and that should be loose, and there's no signal which suggesting that bone is pretty much jammed too. And then finally, you've got some large bones in your skull there called your temporal bones, and they should wobble like that, and I can't feel any movement whatsoever, suggesting you've got a very tight skull all over, which is creating some of this pain and radiating down your body. Okay, Rachel, what we're going to do now is do the treatment. We're going to start working from your hips up to the skull bone. So what I do is just position my hand on your sacrum, which is the bony part of your backside, and then my hand across the bumpy bits of your hips. And what I'm doing, I'm not actually squeezing anything like that. I'm just tractioning, which means gentle coercing your body to actually heal itself. Because below it, you've got this amazing system called your facial system or fascial system, which really wants to realign your body as it should be. And all I'm doing is facilitating that. It might take a minute, it might take 5 or 10 minutes. I just wait until this happens, which is like a therapeutic pulse, which tells me that the job has been done. And we can do this from every point of your body to realign your body, which then creates less pain and lets the pain disappear. Like I said earlier, Nuvian therapy is a non-surgical, non-invasive treatment. It's 3 sessions over 8 weeks and gets great results. Thanks for listening.